Are you thinking about a facelift? Are you just simply overwhelmed with the amount of information that's out there? Confused on where to get started? Check out this video. This video is designed for you. Here we're going to talk about everything you need to know about a facelift, starting at the very beginning from the consultation, all the way down to the very end on what to expect during surgery, after surgery, and long-term after that. Hi, I'm Dr. Athré. I'm a double board certified facial plastic surgeon here in Houston, Texas. I'm also the inventor of the 4D facelift. I do a lot of facial rejuvenation, and I thought I'd put this video out there to help you if you are interested in facial rejuvenation or a facelift. So let's start at the very beginning. Most of my patients check out videos like this, check me out on Facebook, Instagram, all these different avenues, and then send me a little message saying, hey, I'm interested in facial rejuvenation. From there, we start this whole consultation process. The first portion of that process kind of involves getting a little bit of information about you, like your address, your phone number, email address, basic demographic information. Once we get there, we then schedule a consultation. Now, we can do consultations in two formats. One, live, right here in the office, or we can actually do a consultation virtually. We have a lot of out-of-town patients, so that virtual consultation option is definitely an option. However, if you're anywhere close to the Houston area, I do feel that a live consultation in person is so much more worthwhile than a virtual consultation. So let's get going into what actually happens in a consultation. So as you walk into the office, you'll probably be met by Rosa. She'll give you some information about her office, and there's a few forms to fill out. Those forms include your HIPAA, your privacy agreements, and all the kind of general stuff you would expect when going to a doctor's office. Once that's done, you're going to get a full set of photos taken. And then after that is when the fun stuff happens. So you're going to come and meet me, and we do our consultations, as I say, in three parts. The first part is me getting to know you. I need some basic information. Things like your health history, your past surgeries, medications, allergies. So that's the first box of information we get. The second box of information is when I just become quiet, actually. I just let you tell me what it is that bothers you. So most patients have an idea, and they'll start talking about their eyes or their neck or something in there. And I'm just sitting there taking notes. And there's a rationale to this. So most patients, as they've started thinking about this process, they have a little process in their head of things that are important to them. So as I'm writing down that list, most of the time, patients are going to prioritize that list. Once that's done, I'm going to do a little bit of a physical examination. I'm going to take a look at your face, see how the tissues move, and make kind of an overall gestalt. And then we sit down and we get to talk, okay? So I will basically take your needs, your wants, my physical exam, what I think you should do, and smash it all together. In that process of smashing it all together, it really is an open-ended conversation. So for example, I'm most likely going to give you a complete facial rejuvenation blueprint. What that means is as follows. So let's say a patient comes in and says, hey, listen, I'm really worried about my neck. I really would like to have a sharper neck. When I do the physical examination, I may notice that the patient has a lot of laxity in the upper eyelids, as well as laxity along the jawline. So all of these things are going to be outlined to the patient, and the patient doesn't have to do all of them. So one of the things that you may say is, can I do this, Dr. Athré? And it's my job to go, what procedures go together and work synergistically, and what things can be spaced apart? So this is somewhat of an open-ended conversation. So once we've crossed that little bridge and kind of have a game plan of what we want to do in your facial rejuvenation plan, the very next step is to talk about the anesthesia options. So this actually happens in the consultation where I'll say, hey, listen, okay, we've got this idea about what we want to actually achieve. Now, how are we going to get there? So then we start talking about the anesthesia options, which may include local anesthesia with oral sedation, or general anesthesia. And if you're really interested in getting to know a little bit more about these options, there's some videos out here on YouTube, and there's a lot of information on my website about all of these options. So once we've covered all of that, we basically now have a comprehensive game plan. What we're going to do and how we're going to get there. The very next step that happens is I end up chatting with you about some of the risks of the procedure and basic stuff you need to know about the procedures, where the incisions are, how long you need to take off work, all this kind of stuff. So you have a very clear idea of what it is we're doing, how long you need to take off work, what kinds of things you will be required to do, how often you're coming into the office, kind of a brief synopsis view. Once all of that is done, then Barbara, my patient coordinator, is going to chat with you. This is where she gives you an estimate, okay, lets you know how much everything is, how we schedule surgery, so on and so forth. This is basically a wrap up of that entire consultation process. Now, once you've gone through the consultation process and you go, yo, I think I really do want to do this surgery, what happens next? So the first thing we do is we do take a deposit and go, okay, you want to do surgery. These are the available dates that we have. What are your availabilities? Find a date that works for you and me and take a deposit towards that day. So that day becomes your day. In the interim period between where we are today and the date of surgery, we're going to schedule a pre-op appointment. That pre-op appointment's about an hour long, 45 minutes to an hour. This is an appointment that I really recommend if you have a spouse or someone who's going to help take care of you during the immediate post-operative process. Bring them along to the pre-op appointment because there's going to be a lot of information here given to you about what to do, what not to do, things that are expected of you within the first 24 hours. So there's a lot of information I'm going to give you in terms of how to heal and all these things to speed up your healing process. But I'm going to break this up into bite-sized chunks because if I give it to you all at one shot, it's a lot of information. So the pre-op appointment serves multiple purposes. Number one, it gives me an opportunity to kind of reconfirm my surgical game plan with you. It gives you an opportunity to think about any additional questions that may have come up so you can talk to me about those. Then we get our surgical consent forms done. I send your prescriptions to the pharmacy and we discuss your post-operative care. On the administrative side, there's some things that Barb needs to do with you in terms of finalizing payment and all those kinds of things. So these are the large boxes of things that are taken care of before we go to surgery. Once you finish your pre-op appointment, you now know when surgery is and all that kind of stuff. We'll tell you what time to be here. The very next time I get to meet you is on the morning of surgery. I have this funny thing that I always tell patients and say, on the morning of surgery, I'm going to ask you any questions, and the correct answer is no. And I mean this somewhat sarcastically. I'm not going to just say no to you. But if you do have questions, you can always call us, email us, get a hold of us in that interim time period. On the morning of surgery, there's a couple things that I do. Number one, I take another set of photographs on you. Those are your immediate preoperative photographs. I'm going to reconfirm my consents, make sure that all the consents and all that kind of stuff is up to date and clear and is done. And from my perspective, I'm going to go onto the whiteboard and go ahead and start putting out my surgical game plan for the day. Then I'm going to come back to you and talk to you about taking your medications if we're doing local anesthesia with oral sedation, doing my markings on you. Kind of this is me in my head planning what surgery is going to do, what I'm going to do in surgery, and the steps that I'm going to do. Once that's done, then we go ahead and do the surgical process. Most of our facial rejuvenation surgeries, I'd say 95+% of them are done under local anesthesia, and hence they take pretty much the majority of the day. So you're the case for the day. Most of these cases are done around 5 p.m. in the afternoon. Once you get done with surgery at 5 p.m., what do you look like? What are you going to feel like? Most of my patients are actually able to walk down to their car. Okay, I do help you and give you a hand just to make sure that everything's a-okay. But most of our patients are awake, alert, oriented, able to talk. They have a fancy dressing on their face. This part is open, but the rest of this is kind of covered with some cotton gauze and something that looks kind of like fishnet stockings or hose. The reason for all that is to apply a little bit of pressure to this and minimize bruising and swelling. Patients are allowed to eat and drink the night after surgery. I ask them to take it very simple, maybe a little applesauce, mainly just kind of treating themselves just to a very simple lifestyle for that first night. I'm going to see you back the very next day after surgery. So in the morning, so let's say we finish surgery at 5 p.m. in the afternoon, I'm going to see you bright and early at about 8 o'clock the next morning. So the next morning, we get to see you, do a quick physical exam check, make sure everything's going okay, take the dressings off, make sure everything's okay, and then you're going to get the next set of instructions that will take you through the next 1 to 2 days. I like to see patients every probably 48 hours to 72 hours in the first couple of days. So we give you these instructions in bite-sized blocks so that you kind of know what's coming next. Now, during that process, most of our patients are able to return to work roughly in the ballpark of about 8 to 10 days after surgery with some touch-up makeup. They need help with assistance around the house for the first 24 hours. After that, most patients are able to do daily life activities without assistance. With respect to follow-up schedule, so I'd like to see patients probably every 1 to 2 days for the first couple of days. And then after that, I'll see patients roughly at a post-operative day number 7. Then I get to see patients roughly at post-operative day number 10. By post-operative day number 10, all the sutures are out, all the staples and things like that, all that is out, and you're just in the healing process. Most patients are able to go to work at this point in time with some touch-up makeup. They may have some very light bruising, and especially in this area, but something that's pretty easily covered up. Following that appointment, the very next appointment after that roughly is about the 4-week point. We're always available for questions and concerns and things like that, but this is kind of the standard follow-up schedule. And as I said, every patient is very individualized. So sometimes I see them a little bit more frequently. Sometimes I space it a little further apart. Depends on the patient, depends on what exact surgery was done, and depends on if there's any issues going on or things that I need to follow up on. So I really hope that this helps someone out there who's thinking about a facelift or researching about a facelift, about what exactly this whole process looks like. So what we've covered thus far is we talked a little bit about what that consultation looks like, the preoperative appointment, the surgery appointment, and a little bit about what happens after surgery. The point from surgery all the way down to the part where you're doing everything you can and, without limitations, roughly is about 10 days to 12 days. And I will continue seeing patients at the 3-month post-op and 6-month post-op and so on and so forth. A lot of this is just for me to kind of see how things are going. By about the 6-month post-op, everything is completely healed. And patients sometimes follow up with me longer term after that based on if they choose to. We have a lot of out-of-town patients. Some of them it's not financially appropriate for them to keep coming back, but I still get photos and videos and things like that from my patients. So I hope this has helped the viewer. I hope that you got a lot of information about this. If you found this content really helpful and useful, please hit the subscribe button so therefore you get notified when we have put more new content out there. Thank you so much for listening and watching. If you've got comments or anything like that, please be sure to send it down to us in the comment section and we'll try to get to them as soon as possible.